have Scott Kasper in the house. He's Assistant Vice President, Emergency Services at Virtua. Good to see you, Scott.
Thanks, Steve. Good to see you.
By the way, is there a difference between EMTs and paramedics?
There is.
What is it?
So EMTs are emergency medical technicians. It's basic life support. So they have about 400 hours of training. They're really good at taking care of the initial care that needs to be provided in any emergency. But when patients are really sick, the truly life-threatening emergencies, that requires a paramedic. Paramedic training in New Jersey is a 2-year process at many of the community colleges throughout the state, where the first year is classroom didactic training, and the second year is like a medical residency. They do rotations through the hospital units. They do a field internship with paramedics, so they're really learning how to take care of patients in a real environment, and they become really expert at what they do.
You call 911, right?
Sure.
People, we teach our children that. We try to remember it ourselves.
Yep.
We don't really know what goes on the other end when that happens. What goes on?
So you call 911, and the first thing that happens is a call taker tries to decide whether you're really sick or really not sick. That the first initial triage or dispatch is based on that. So they'll ask you questions. If you're really not that sick, I twisted my ankle, I can't get to the hospital myself, or some other minor medical issue like that, they're going to send the local basic ambulance service squad that's in your community. If you use words like, I'm having trouble breathing, I have chest pain, I think my father's having a stroke, things like that, they'll also send that basic life support ambulance squad from the community. They'll get there first, in most cases, really fast. And then they'll also add the paramedics on top of that, so that the paramedics can do some of the more advanced life support. The best way for the lay public to think about paramedics is we essentially bring the emergency department to your living room.
Oh, whoa. You bring the emergency department?
The equipment, the medications, the skills that the paramedics have in their truck is very similar to what would be done in the emergency department. Obviously, we don't have x-ray machines or CAT scanners.
But what are you doing? Excuse me for interrupting. So, Scott, what are you doing out there as soon as you get there that gives that person a shot?
Right. So after the basic life support folks have done their thing and we come in to supplement that, we're starting IVs, we're putting a patient on a cardiac monitor, we're helping to diagnose whether or not that patient's actually having a heart attack. We have more than 40 different medications in our med box that we can use to begin to treat and stabilize those patients. As a matter of fact, a lot of what we do right now in today's EMS system is we stay right there with the patient to try and get that patient stable before we move them to the ambulance to go to the hospital. So it's all kinds of things that are really dependent on the case, but these folks save lives every day because of that.
So, Scott, recently it was traffic jam, which is par for the course in New Jersey. And so there's an ambulance in the traffic jam, and I say to myself, wait a minute, there's something not right here. But somehow the ambulance is able to navigate its way through. Everyone's, we're pulling to the side, but I'm thinking, how does this happen? What happens in that situation? Explain to folks what the protocol is, and also what technology is involved to change that dynamic so that the medical professionals can get to the patient who needs that help.
Yeah, that's a great question, and I think the first thing I would ask your viewers is, if you do see an emergency vehicle, pull over to the side of the road as soon as it's safe to do that. So
Doesn't everyone do that?
Oh, you'd be surprised. Everyone should be doing that, but as you just described in your question, we often experience slowdowns because of those traffic scenarios. But we've implemented some technology to try and help us avoid that at Virtua in South Jersey. We're now using traffic predictive technology to help us dispatch a unit that can get there the fastest, that's not necessarily the closest. So the scenario that you just described, perhaps the other side of that highway didn't have as much traffic, right? At certain times of the day, we know that the traffic is dense going south, but it's not so dense coming north. Our technology now lets us know where all of our units are, and based on the incident location, how quickly they can get there based on the actual traffic conditions. So we may have a scenario where a unit is a little bit further away from a distance perspective, but because the traffic is different, coming from the opposite direction, we'll be able to get there the fastest. And that's what we're really trying to do.
So in terms of misconceptions, someone says, well, I want the ambulance, I want the medical professionals that are, quote unquote, closer to me. That's not always the smartest.
It's not always the smartest. You know, the whole misconception about how fast the ambulance gets there is something that we're really trying to re-educate people about right now as well. It's not necessarily that faster is better. You know, what we're talking about is bringing medicine to your home, and it's clinical care. It's not just racing to the scene and then racing to the hospital. It's what we do in between that really makes a difference in patient outcomes, and that's really what we're trying to promote.
Who are the professionals, the medical professionals, the men and women who you work with every day? What kind of people are they?
Oh, they're the best. These are men and women who are dedicated to working long hours in really not the greatest conditions, to give of themselves to save other people. They put themselves in harm's way every day. You know, it's a very, very difficult, stressful job. And the men and women that I work with every day really try to become the best at what they do. It's not just a job for them. It's really a calling, and it's a craft that they have to practice to get as the best that they can be at practicing that craft on patients when it really, truly matters.
What do you get out of it?
What do I personally get out of it? Listen, I used to be a paramedic in the street, and I would be able to take care of a handful of patients a day, and it was a phenomenal opportunity for me. Now, where I sit, I help manage a system that takes care of hundreds of patients.
Because you're part of a larger operation?
So Virtua provides paramedic services to all of Burlington and Camden counties. So our regional system takes care of many, many patients every day, and the work that I do, the decisions that I make, sort of makes or breaks that model. If we're doing our job right, my paramedics in the street are able to do their job right, and people get to go home at the end of the day to their families.
You love what you do.
Love what I do, every minute of it.
Scott Kasper is Assistant Vice President of Emergency Services at Virtua. We thank you and your colleagues and all those who do what you do and help all of us and those we love who are in desperate straits every day. Thank you so much.
Thanks, Steve. Appreciate it.
Stay with us. We'll be right back right after this.
The preceding program has been a production of the Caucus Educational Corporation, celebrating over 25 years of broadcast excellence. Funding for this edition of Caucus New Jersey has been provided by Verizon, Adler Aphasia Center, QualCare Inc., the New Jersey Office of the Insurance Fraud Prosecutor, New Jersey Sharing Network, the New Jersey Reentry Corporation, and by Montclair State University. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area. Caucus New Jersey has been produced in partnership with TriStar Studios.